Welcome to the Allura Home Health Vlog. This is a spot where you can get thought leadership, information on topics that matter to your agency today.
You know how it feels, right? Your day is just relentless, trying to stay on top of everything. It's like a whole separate job.
Yeah, it really is.
Well, that's why we're doing this. This is the deep dive. We take a big, sometimes kind of messy topic and boil it down to what you really need to know, giving you the insights without you getting totally bogged down.
Exactly. We do the heavy lifting for you, basically, sifting through it all to find those key nuggets. And today, we're focusing on something really fundamental for, well, any organization that wants to run smoothly, improving processes and workflows.
Okay.
And we're looking at it specifically through the lens of home health agencies. We're drawing on insights from Cindy Rushing. She's got decades of experience in this specific field.
Right. And listen, this isn't just for people in healthcare. Maybe you're interested in how effective systems work, period. Or maybe you just want to understand the healthcare world a bit better. This deep dive, it's for you. We want to give you some practical stuff you can really, chew on without it feeling like you need a PhD to understand it. So let's start at the beginning. What are we actually talking about with process versus workflow?
That's the perfect place to start because, people mix them up all the time. Cindy Rushing makes a clear distinction. Think of a process as like a specific series of steps for one particular goal.
Okay.
It's contained. It's got a clear beginning and end.
So like a mini project almost with one outcome. What about workflow then?
Workflow is the bigger picture.
Yeah.
It's the whole sequence of those processes.
Yeah.
How work moves from the very start right through to completion.
Ah, okay.
It's the entire journey.
Got it. So like a patient intake process is one step, but the whole new patient onboarding workflow includes that, plus insurance checks, plus scheduling, that whole chain.
Exactly. That's the idea.
Okay, makes sense. Now, Cindy Rushing uses this really striking analogy opening Pandora's box when talking about looking into these processes. What's she getting at there?
Yeah, it's a great image. It really highlights how interconnected everything is, especially in something complex like home health. Rushing points out that no single process just exists on its own, right? It's tied into this whole web of other processes, other workflows. So when you start poking at one thing, maybe trying to change it, you suddenly realize it affects stuff way over there, in another department maybe. You lift one lid, and all this unexpected complexity kind of pops out.
So you think you're just making one small tweak, and suddenly it's like, oops, that impacts scheduling and billing and clinician reporting, like pulling a thread and finding it's attached to everything.
Precisely. You can feel like a can of worms, like you said.
Yeah.
And that's why she warns that opening this box can, at first, feel like you're creating more problems.
Right.
Because fixing one thing might mean you have to look at 3 other things to make sure the whole workflow doesn't break. So the big takeaway from that analogy is you need a structured approach. You can't just dive in randomly.
Okay, so acknowledge the potential chaos, but have a plan to manage it. That makes sense. Luckily, Cindy Rushing gives us that structure. She lays out 8 key steps for improvement. Let's get into step 1, defining the purpose and scope. What's key here?
This is really the foundation. Rushing emphasizes how vital it is to first clearly write down what you're trying to achieve. What specific problem are you fixing? What are your goals? Measurable ones if possible.
Okay.
And just as important is defining the boundaries. What's in this evaluation, which processes, which departments, and what's out, at least for now.
Right. Scope creep is real.
Totally. And finally, identify who's going to be affected by all this, your stakeholders, who needs to be involved, who needs to know.
Makes total sense. Like planning a trip, got to know where you're going and who's coming along.
Wow.
Setting those guardrails early keeps you focused. Okay, step 2 is getting feedback from the team. What's Rushing's advice on how to do that effectively?
Yeah, she strongly advises getting input directly from the folks doing the actual work every day. And her big recommendation, talk to them individually.
Oh, interesting. Not in big group meetings.
Well, she suggests individual interviews are often better at uncovering those little differences in how people do things.
Yeah.
Or maybe steps that are redundant, things that might not come out in a group.
Why is that? You'd think a group brainstorm might surface more ideas initially.
Group sessions can be good for brainstorming, sure, but Rushing notes that sometimes, especially if there are managers in the room, people might hesitate to, be really critical or point out problems.
Oh, okay. The dynamics.
Exactly. So those one-on-one chats or even anonymous surveys can create a safer space for really honest feedback. The goal is just to get that rich, detailed picture of how things actually work, including the glitches.
That's a great point about group dynamics, sometimes silencing honest input. Okay, step 3. Map the process as is. How do we do that?
Right, so once you have that initial feedback, the next thing is to visualize the current process. Rushing suggests tools like flowcharts, diagrams, outlines, whatever works for your team.
Visuals help?
Definitely. But the absolutely critical part here, map how it really happens now. Not how the procedure manual from 5 years ago says it should happen or how you think it happens. Map the reality.
Capture the ground truth, even the messy bits. Why is that so crucial?
Because you can't fix what you don't truly understand. Mapping the as-is gives you that clear snapshot. It makes it way easier to spot the bottlenecks, the inefficiencies, the places people are getting stuck or doing extra work.
Yeah, okay.
And Rushing also says, make sure you define the inputs and outputs for each step, who's responsible for what, and where this process relies on or feeds into other processes.
Seeing it laid out visually can really make those problems jump out, can't it? Okay, step 4 moves us to analyzing performance data. What kind of data are we looking for?
Yeah, now we move from just the steps to how well it's working. Rushing says you need both quantitative data numbers, basically, how long things take, error rates, costs, and qualitative data like feedback from patients or staff about their experience. The key is defining how you'll collect this and what actually counts as success or failure for this process. And look for duplication, too. Are different people doing the same thing unnecessarily?
Right, so it's not just a hunch anymore. It's using data to pinpoint the real issues. Step 5, then, urges a systemic approach. What's that mean here?
This brings us back to that Pandora's box idea, really. It's about remembering everything's connected. Rushing warns against just zeroing in on fixing one single process without thinking about how it affects everything else.
The ripple effect.
Exactly. You might streamline step C, save 10 minutes there, but accidentally create a huge pileup at step D, or make someone else's job way harder. You could actually hurt overall performance if you're not careful. It's like fixing one part of an engine without checking how it meshes with the others.
Yeah, that domino effect. You got to see the whole board before you move a piece. Okay, step 6 introduces a familiar tool. SWOT analysis. Strengths, weaknesses, opportunities, threats. How does that help with process improvement?
SWOT is super useful here. It gives you a structured way to look at a process and identify not just problems, but also potential. So, strengths. What's working well right now? Weaknesses. Where are the problems? The inefficiencies. Opportunities. What could we do better?
Yeah.
What external factors could help? And threats. What could derail our improvement efforts? Internal or external stuff. Rushing says really think about what's holding you back, but also what advantages you already have that you could leverage.
So it's balanced fixing the bad, building on the good, and prepping for obstacles. Makes sense. Step 7 is about prioritizing. With limited resources, how do you pick which processes to fix first?
Crucially, Rushing says you have to look at the whole workflow when prioritizing. Even if the symptom, the problem you see, is late in the game, the actual root cause might be way back at the beginning.
Ah, okay. Don't just treat the symptom.
Right. So do that holistic review. Then figure out which changes will give us the biggest positive impact. What are the potential benefits versus the risks? And really importantly, what resources do we actually have? Personnel, time, money. Be realistic.
Right. Go for the biggest bang for your buck, but also what's actually feasible. That's practical. Okay, final step, step 8. Monitor the improvements. Why isn't this just a one-and-done thing?
Because improvement isn't really an endpoint. It's more of a cycle. Once you make changes, you absolutely have to keep an eye on whether they're working as intended.
Check if it actually worked.
Exactly. Rushing suggests using things like regular feedback loops, ask the team how the new way is going, use project tools like Gantt charts to track progress, or maybe specific software. The goal is to see if you're getting the results you wanted and be ready to tweak things further. It's rare to get it perfect on the first try.
Continuous improvement, always checking, always adjusting. Okay, so we've gone through all 8 steps. Pulling it together, what are the big takeaways from Cindy Rushing here?
Well, a major theme is that managing this whole improvement thing effectively is key to not getting overwhelmed by that Pandora's box complexity we started with.
Right.
She really hammers home the need to analyze how processes connect, where they overlap, where there's redundancy, understand the ripple effects, positive and negative, of any change across the entire workflow.
See the system.
Yes. And the SWOT analysis comes up again as a really valuable tool for spotting those opportunities.
Yeah.
And finally, just reinforcing that monitoring and adjusting. It's iterative. It's a continuous loop that leads to better operations, better health for the agency overall.
It really does all come back to seeing it as a connected system, doesn't it? You can't just fiddle with one part in isolation. Well, this has been really illuminating, a true deep dive into Cindy Rushing's approach to process improvement in home health. We've covered a lot. Hopefully everyone listening now has a clearer framework for thinking about this, whatever their field.
Absolutely. The goal is getting you that core understanding efficiently and hopefully in a way that sticks. This deep dive was brought to you by our friends at Allura Healthcare Systems.
They're a leading provider of home health software solutions.
Their platform is designed to help CEOs, executive teams, and caregivers manage all the complexities of home care.
All those moving parts.
From referrals and patient care to productivity finances, personnel and compliance.
They've got it all.
Head over to allurahealth.com or give them a call at 1-800-954-8250 for a free software assessment.
So as a final thought for everyone listening, thinking about these 8 steps, what's one area in your own work, your own world, where maybe applying this kind of evaluation, really looking at the as-is, could lead to some real improvements? And maybe think about that Pandora's box. What potential disruption might actually be worth facing for a bigger long-term gain?
Yeah, where could that focused effort on the underlying processes really pay off down the road? It's a great question to reflect on.
Definitely. Well, thank you so much for joining us for this deep dive. We really hope this has been insightful and maybe even immediately useful for how you look at the workflows around you.
Thanks for listening. We'll catch you on the next one.